Hello guys! So, good morning! So, nasa Module 11 na tayo. So, welcome to our finals and our topic for today is two information system, which is Cardiology Information System and Radiology Information System. Guys, these two information systems are very much in charge in the management of the different images for diagnosis, for monitoring the heart and other body parts. Yan. So that we can visualize the heart and other body parts. Class, we use different equipments and different machines. And this machines class produces images. So for a big hospital, they produce so much images. And class, these images are very important so that the doctor can easily diagnose your patient. Alam niyo naman na yun. So just like your laboratory results, your images should also be readily available for your physician, so they could completely diagnose. They would have a 360 degree view of the patient. So kailangan it would be really accessible. They could see it side by side. So what could help us with that? So our cardiology and radiology information system. So maikli lang itong discussion na to, guys. And I hope that you could learn something today. So class, simulan natin with your cardiology information system. So they are the one who stores and retrieves cardiocentric images. So class, in some hospitals which are really big, all the images that visualize the heart are separated with your radiology department or your radiology information system. So meron ganito, cardiology information system. It is used for acquiring the images, for further distribution, viewing, and long-term archiving. So for long-term storage. So class, so through the internet, it improved the creation of networks and facilitate the integration of our cardiology information system. So class, it stores and retrieves the different images that visualizes your heart. So class, for this part, I think I have 5, kung di ako nagkakamali, 5 different sources of visualizing the heart. So different diagnostic procedures to visualize the heart. So number 1, class, we have cardiac ultrasound. So class, notice kung anong ginagamit. Ultrasound ba, X-ray, or radionuclides. So class, there are different ways to visualize the heart. Either we're going to use ultrasound waves, X-rays, and radioactive radionuclides, ganyan. Or radionuclides can be seen using gamma rays. So we are using different types of radiation to visualize the heart. So class, first one is your ECG or cardiac ultrasound or echocardiogram. So for echocardiogram, we utilize ultrasound, class. So it tests that uses high frequency sound waves to make pictures of your heart. An echo uses sound waves to create pictures of your heart's chambers, valves, walls, the aorta, arteries, veins of your heart. Yan. So, ultrasound. So, hindi lang siya ginagamit para ma-visualize ang embryo of the pregnant women, but also the heart. Yan. So, ang tawag dyan is cardiac ultrasound or ECG. Echocardiography. Sabi ko electrocardiogram. Okay, echocardiography. Okay, next class we have computerized tomography. Computerized or CT scan. Class, ang ginagamit dito, X-rays. So this is a bigger version of your X-ray machine. So images taken from different angles around your body and uses computer processing to create a cross-sectional images, slices of the bones, blood vessels, and soft tissue inside your body. Yeah. So class, sabi nga, gumagawa siya ng cross-sectional images. Yan. So ito parang trans-abdominal to. So natin dito sa may bandang or parang transthoracic kasi parang may, ewan ko, class, hindi ako expert dyan. So, ganun. So, they make slices of your body so that they could visualize the different parts of your body. So, since we are in cardiology information system, so para makita rin yung heart. So, parang pumapasok sa isang chamber. And they bombard you with x-rays. Next class is magnetic resonance imaging. So for magnetic resonance imaging or MRI class, magnetic fields naman ang ginagamit yan. So this machine class contains powerful magnets yan. So ang galing. So class, ang magnet MRI, ang forte niya, it is more detailed when it comes to soft tissues like your brain, ganyan, mga soft tissues, mga organs, mas malinaw siya. Pag CT scan class, usually, mas malinaw yung mga bony structures. Yan, oh. So, yung heart, yung GIT. So, ang ganda, galing guys. So, differentiate natin. Class, yung MRI and your CT scan. So, your MRI, detailed pictures in soft tissues. For CT scan, less detailed compared to MRI, especially for soft tissues. MRI naman, bony structures are less detailed compared to CT scan. Pag CT scan, bony structures are more detailed and clear. Plus, I know that you don't have any plans. Hopefully, no one will have CT scan or MRI. But class, what if someone you love will undergo MRI or CT scan? Which is more expensive? MRI, mas mura ang CT scan, but they are both expensive. They are pricey. Yan. So that you have an idea if it's the best decision to go for MRI, it's the best decision to go for CT scan. At least, diba, we have an idea. Ayan. So, please apply what you are learning. So, MRI, no known side effects on radiation, very few side effects on MRI, contrast scans, so pag kailangan ng dye, ganon. CT scans, little side effects, frequent radiations with CT scan may rarely cause cancer, kasi nga x-ray yung ginagamit. Due to the structure and sound, claustrophobia, patients may need to take anesthesia. Scan procedure is very simple in CT scan and do not require anesthesia. MRI, duration of MRI scan is much longer. So CT scan mas mabilis. MRI is more expensive. MRI, you may be asked to hold your breath from time to time. Yan. CT scan, holding breath is not much required. Patients with metal or certain medical implants, hindi pwedeng mag-MRI kasi nga magnetic field nga eh. And class, so the CT scan, there's no risk for medical implants. Ayun. So class, if you have a medical implant, especially if it's made of metal, you cannot forgo MRI. Diba? Ang galing. In class, I think there's no other subject where we could discuss this. So, sa HIS lang siguro natin madiscuss ang mga MRI, CT scan. We have PET, so cardiac positron emission tomography scan, and cardiac single photon emission computed tomography. So, merong computed tomography, CT. Yan. So, mga emission tomography naman isa. So, these are non-invasive nuclear imaging. So here, guys, we use radionuclides or radioactive tracer. So class, a person needs to be injected with radioactive tracers used to diagnose coronary artery disease and damage to a heart attack. Class, I don't know if I already told you that I tried being injected with radionuclide nung nuclear thyroid scan ako. So, parang almost the same thing. So, they will inject you with radionuclide. Tapos, pag in-scan yung thyroid, in-scan yung thyroid ko, nag-glow siya. Kasi nga, na-injectan ako ng radionuclide. So, for a day, I was radioactive. Yan. I was not allowed to go near pregnant women. Yan. Kasi nga, in-injectan ako so that they could visualize my thyroid well. So same thing with here. So that they could visualize coronary artery disease, they will inject radionuclide, and they will use PET scan or SPECT scan. Yan. So yan, so it will glow. Ganyan. So parang ganito rin yung results nung nung nuclear test ko sa thyroid ko. So the different images will show the disease category. Yan. So, class, nung thyroid nuclear scan ako, punta ako sa isang nuclear laboratory. Yan. So, humingi ako ng discount sa mga medtech friends natin. Okay, we have coronary, kasi ang mahal niya, class. We have coronary angiography is a procedure that uses a special dye or contrast material and x-rays. So, they will inject you a dye. Yan. So, yung kanina, radionuclide yung in-inject. Now, it's a special dye. Tapos, they'll use X-ray to visualize if there are obstruction in the blood flow. Ganyan. That's coronary angiography. Yan. So, class, so imagine if a person requires so much diagnostic procedures and so that the doctor could see it all and interpret it all, then having a cardiology information system will be really good, class. So, ease of access while maintaining data security. So, the doctor will be able to consolidate. Yan. Kumbaga, mas madaling niyang ma-visualize itong mga multiple cardiocentric images. There's a flexibility in the workflow. So, perhaps the doctor could also access it in their smartphone and enhance comparability. So the retrieval of multiple images is convenient. Hence, comparison and correlation enables health professionals to make more informed decision. Example, class. If you know someone with a heart disease, isn't it that they have to go to the doctor every 3 months or monthly, and they would have to take a test regularly so that the doctor could find patterns or any improvement with the heart problem. Syempre, kailangan niya sabay-sabay tingnan itong mga images na to and compare it. So it will help the doctor to have a more informed procedure on the maintenance of the patient or the management of the patient. Yan. So napakalaga. So other functionalities of your CIS for editing, viewing, and storing multi-modal cardiology data. Yan. So, kumbaga, images are managed in a single platform. Isn't it that class Facebook is so convenient because in a single platform, you could talk to your crush, you could buy stuff in the FB marketplace. There is so much, may mga memes, yan. In single platform, you can do so much thing. Same thing with your CIS, yan. So you can do so much thing with your cardiology-centric images. You can have remote access, you could access it even though you're far away, yan. Visualization and reporting capabilities, so virtual real-time information, retrieval possible at any time and anywhere, and electronic health record integration. So it could be integrated with the personal information of the patient. So what's the medication, what's the family history. So to give a 360 view of the patient's health status. And class, finally, we also have radiology information system. So it also manages your images in the radiology department. So we could track imagery disorders. So same thing with your laboratory information system. Isn't it that the doctor orders different tests? Same thing with your radiology department, class. The doctors order different x-rays. X-ray ng heart, x-ray ng lungs. Isn't it that they should get it right? They should take the right image. Yan. If they will take the wrong image from the wrong patient, same thing, di wrong na rin yung result. They archive pictures. Yan. So for picture archiving, either they use PACS or VNAs. PACS means PACS is Picture Archiving and Communication Systems or Vendor Neutral Archives. So these two are technology that stores medical image in a standard format or interface. Yan. So I saw a website wherein they are comparing which is better, PACS or VNAs, yan, and billing. So I'm just here to introduce it. So the advantage of RIS, Radiology Information System, improve the overall operations of the institution. Yan. So that to facilitate the facilitate easier radiology is also diagnostic. So para magkaroon agad ng diagnostic results, yan, RIS could help with that, easier access to patient information, improve the patient experience, allow faster processing of payment. Same thing with the laboratory. So if the doctor ordered something, the patient should pay for it. So faster generation of reports and results, hence enhancing the workflow. Yan. So other functions, so we could schedule. Class kasi naman, isa lang naman ang x-ray, isa lang naman ang ultrasound, di ba? We have better patient management, results reporting. Your radiology information system and cardiology information system, they not only just store the images, but they also store the interpretations of your results, diba? Pating interpretation ng radiology. So, radiologists or sonographies. So, kung magkakahiwalay, so if it's all separated, it's not very well organized. Image tracking, billing, patient tracking, yan. So class, actually there are scale. So some hospitals, many hospitals class have limited resources. You only have 1 x-ray or 2 x-ray. You only have few radio technologists. And you have to bring the patient inside the x-ray room. So that to facilitate their scheduling, diba? We need an information system. And to make sure that we got the specification of the doctor correctly, then we should be assisted by your radiology information system. Yan. So class, that's the end of our topic. Yan. So class, for me, as someone who masyadong maraming sakit, for me, there's something wrong with my thyroid, there's something wrong with my ovaries, I get ultrasounds regularly. Yan. So to help the doctors to diagnose me well, it's better that they organize it in an information system. So I'll see you again, guys. Bye-bye.